Today you're in for a special treat. We're going to have a guest that's joining us. Who is a specialist in hormone-related therapy, as well as one of the leading bioidentical medicine specialists in the state of Tennessee. Stay tuned, and we'll be back.
Hello, thank you for listening to Thyroid Hair Loss Connection podcast, a science-based, honest, candid conversation about how your thyroid affects your hair. You will learn practical solutions to hair growth, healing your thyroid, and balancing hormones with holistic nutrition approach and the latest treatments. Your hosts, me, Natalia Sanzo, a registered dietitian, aka Nashville thyroid expert, and Kimberly Vaughn, a board-certified trichologist, hair loss specialist, and coach. To stay up to date on the latest topics, make sure to subscribe to our channel. We also cannot do this without you. Send us a question to the link below and tune in each week for the answers. Now, let's head to the show.
Today I have the pleasure of welcoming Dr. Jack Monaco to our show. Dr. Jack is the head founder of Integrative Medicine Specialist and Bioidentical Hormone Specialist, which are located in Franklin, Tennessee, just outside of Nashville. Just to share a little bit about Dr. Monaco's background, we want to let you know that he is graduated from Wake Forest School of Medicine in North Carolina. He is double board certified as an OBGYN, as well as a functional metabolic medicine specialist. And today, Dr. Jack is going to share with us a little bit more information and more details on his specialty regarding thyroid hair loss connection. So welcome, Dr. Jack. Thank you for joining us today.
Thank you for having me.
So I think what we want to do is jump right into kind of the crux of the problem regarding the thyroid and the hair loss connection. So tell us a little bit, why did you move out of the specialty of being an OBGYN into the specialty of thyroid and hormone?
Well, you know, like many doctors who've gone through the fellowship that I did through the American Academy of Anti-Aging Medicine, they were searching for something that would help them. Many of my colleagues have had an issue which conventional medicine was not addressing. For me, it was ulcerative colitis. And the stress of being an obstetrician, the night call, the interrupted sleep was taking its toll on me physically. So I went to my first conference and I learned that there were many, many things that I was not taught in medical school or through my residency that would help my patients. So I joined the fellowship and completed that in 2007, and have been practicing functional and metabolic medicine with my health and healing centers since that time.
And so let's see, you're fairly new to the Tennessee market, right?
I am. We came down here in 2014. I was actually recruited to come down here to do hormone restoration since there aren't too many doctors here that really understand how to do hormone replacement. And I'll be honest with you, Kimberly, I was one of them. I was trained as an OBGYN, and I thought I knew how to do hormones. And then I realized after doing my fellowship that there's so much more to hormones than just making symptoms go away. So that led me on my journey to, and it was actually a patient, believe it or not, that told me about bioidentical hormones. And this was back in the late 90s. So I've been doing bioidentical hormones for, over 20 years.
Wow. Well, and I'll share with the listener also that you agreed to also help HPI Hair Partners and step in as our medical director because you knew that there was such a connection between thyroid and hair loss. And so we want to always thank you for all of your advice and all of your oversight, because you have definitely made our practice much more stable with your insight and knowledge.
Well,
so
thank you.
we thank you.
I appreciate that.
So moving into then hormone restoration, tell us a little bit about, when we talk about hormone restoration, is that like a large kind of parent topic and then everything factors down from there, such as then the hormone of thyroid and then the hormone of estrogen, the hormone of testosterone?
You know, it's interesting because hormone restoration used to be giving a woman estrogen and making her symptoms go away. And then the last 20 or 30 years, it's kind of morphed into guys. Guys never used to get hormones because guys didn't need hormones. We were just, macho. And there's a lot of misinformation and misconception about hormones. Even to this day, conventional doctors consider hormone therapy to be dangerous or not productive. And they don't really understand the difference between a bioidentical hormone and the conventional hormones. Now, the term bioidentical has become a buzzword. Okay, you see it all over in social media and any information. And when you Google, for instance, you Google the term progesterone, you're going to see a lot of things that are attributable to progestins, which are not bioidentical, and that's what's conventionally used in birth control pills and in postmenopausal hormones. But they're very, very different. So first of all, there's terminology confusion amongst doctors and patients. There's a lot of misinformation and misconception. I have patients come into my office just about every day that tell me that their gynecologist doesn't want them on hormones because it's going to increase their risk of cancer, breast cancer, heart disease, and so on. And that is true of the conventional hormones, not the properly restored bioidentical hormones. So when you look at hormones, if they are properly done, properly dosed, properly balanced, they're actually preventative medicine. And there's literature to support that.
Wow. So I think we're going to have you back again to review all of these hormones regarding male and female hormones. But today, let's focus back on our thyroid issue. So how do I know if I truly have a thyroid problem?
Well, that's interesting because the three things that patients come to me with their main complaint is difficulty with sleep, difficulty with libido, and hair loss. So when you look at hair loss, obviously as we age, our hair is going to thin. But if you look at the top reasons that patients will experience hair loss, number one is going to be stress. Okay, number two is going to be thyroid. Then you have hormone deficiencies, you have nutritional deficiencies, and then you have diseases of the scalp, which we don't really see very often. So very commonly, I will see a lot of thyroid issues. Now, patients will come in and tell me that their thyroid tests were normal, but they have a lot of symptoms: cold hands, cold feet, cold body temperature, dry skin, brittle nails, thinning hair, weight gain that they can't lose, constipation, and so on. And the problem is, when we're going through our training, we're not taught how to properly evaluate the thyroid. We do a couple of tests, which we can get into at some point, but that doesn't really tell us about function. So when we look at these hormones, we're looking at function. How is the thyroid working? Just because your tests are normal doesn't mean it's working properly. You could have an 8-cylinder car and 2 of your cylinders aren't working. The car's still going to run, but that doesn't mean it's running efficiently. We also know that there's a connection between thyroid, adrenal, and hormones. So these things all work together as a triad. So you can't fix one without looking at the other. They will interact with each other. And we can talk about how stress can affect the hormone responses that we see. So you can have normal hormones, but still have symptoms of deficiency because of stress.
Okay, great. So we've touched on these lab tests before in some other episodes. Can you talk to us specifically if an individual is having some of these symptoms, such as problem with sleeping, problem with their libido, their hair is shedding, they have constipation, they have weight gain, and they go to their general practitioner and they have their labs ran, right? Mm-hmm. And then the practitioner comes back with the knowledge that they have and says, oh, wow, everything's normal. Mm-hmm. What do we tell these poor listeners, and what do they do next? How do they dive into the depth of all these symptoms?
What they usually do next is they come to see me. Okay. And seriously, my practice started as pretty much bioidentical hormones for women. Mm-hmm. And it's now morphed to probably 50 to 60% of my practice is thyroid. And patients are coming in and their doctor keeps telling them that your thyroid is normal. We're giving you some levothyroxine, some T4, and your numbers are normal. But the patient says, I don't feel well. What people don't realize is that what is commercially available, T4, levothyroxine. Some people may know it as Synthroid. All right, that's a storage form of thyroid. T4 refers to how the body holds on to thyroid, if you will. So I tell patients the T4, 90% of the hormone in your body is in the form of T4. It's storage. It's like the gasoline in your gas tank. It's there when you need it. When your body needs thyroid hormone, it takes an iodine off to make T3. That's the active hormone. So doctors are taught, if I give you T4, it's safe because it's inactive, it's storage, and your body will convert all the thyroid hormone that it needs into T3, which is a true statement in a perfect world. Not being a perfect world, the doctors aren't measuring T4. So they'll measure T3. They'll measure a T4 and they'll measure a TSH. TSH is the signal from the brain that tells your thyroid to make thyroid hormone. So they measure those two things. So imagine if you took your car to the mechanic and told the mechanic that it just doesn't have any energy, it's not running right. And he says, well, let's measure how much gasoline you have. That's your T4. Got plenty of gasoline in your gas tank. And then he says, let's check the charge on your battery. That's your TSH. So he says, your car is running fine and hasn't even started the engine. So that's the problem with thyroid. Doctors are looking at T4 and TSH, and they adjust a patient's medication based upon the TSH. But if the patient has all of these symptoms, the doctor says, well, it's not your thyroid, you must be depressed. Mm-hmm. So the next thing they do is they go to their primary care doctor, they go to a psychiatrist, and they get an antidepressant or an SSRI or some medication like that. And they're not feeling well.
Oh, my gosh.
It's awful.
And it takes them totally down the wrong direction because it's just their general makeup and health that's really at fault, not anything regarding a psychological state.
Yes. And you don't have to have thyroid disease. See, we're taught in medical school high, low, normal. So you either have hypothyroidism, hyperthyroidism, or everything else is normal. In functional medicine, you can have a dysfunction of the thyroid, meaning that your thyroid tests are normal, but you have symptoms of low thyroid, and there is something that's affecting how that thyroid works. Doesn't matter how much T4 you have, how much you convert to T3, what your TSH is. If it doesn't get to the receptor, it's no good. You're going to have symptoms. Mm-hmm. And there are things that will block the receptor. And the number one thing that blocks receptors is cortisol, stress.
Right. Okay, so I have my T4 checked, right, traditionally. They're going to also check my TSH. So my gas is great, my battery is functioning fine, but why am I still feeling bad?
Because A, you're not converting T4 to T3.
And how do I find that out, though? You
do the tests.
Okay.
So you do T4s and T3s, and you can see how much of your T4, they should be roughly equal, okay? But you can see, I see it all the time where I see T4s are in the upper normal range, and I see T3s are in the lower normal range, and the patient has symptoms of thyroid deficiency. But their T4s are normal, and their TSH is normal.
Okay. And then I know I've also heard a lot about TT3 or TT4 or reverse 3, reverse 4 to help us understand that.
So TT3 and TT4 is total T4. Okay. That's how much T4 and T3 you have in your body. Now the 4 and the 3 refer to the number of iodines that's on the thyroid molecule. Okay. A certain percentage of that is free. So there's a small percentage that's free. You have to unbind the thyroid to get it onto the cell's receptors. So you carry, it's like a boat. You put your boat on a trailer and you bring it to the lake, and then you have to unbind it. You have to take it off the trailer to get it into the water. So you have to take the T4 and the T3 off the receptor to get it on, off the binding protein to get it onto the receptor. Now, most of that conversion occurs in the periphery. You don't have a lot of T3 circulating because it's the active hormone. If you had too much T3, then you would be hyperthyroid. So your body takes the T4 where it's needed, takes an iodine off, and there are enzymes that do that, and that's what activates the receptor. Reverse T3 is an analog of T3, T3 being the active hormone. So reverse T3 is what we have to protect us from an overactive thyroid. Okay, so you have 4 iodines on T4. You take off one iodine and you have active T3. You take off a different iodine and you have reverse T3. Now, reverse T3 fits into the receptors. Remember, all of these hormones depend upon receptor response. It doesn't matter how much hormone you have, it has to stimulate the receptor on the cell. So on the thyroid cells, the T3 will activate that receptor. Reverse T3 fits into the receptor, but it doesn't activate it, it blocks it. It's like a key that fits into the lock but doesn't turn the cylinder. Why do we have that? To protect us from an overactive thyroid. Too much thyroid can kill you. It's called thyroid storm.
Sure.
So if you have a nodule that's making thyroid hormone, or somebody's overdosed you, or sometimes you're taking way too much iodine, you'll have an overactive thyroid, and that can raise your blood pressure, raise your heart rate, raise your body temperature, and it can kill you. It's a medical emergency. So God gave us reverse T3 to protect us from that.
Oh my gosh. Wow. So I now have, let's see, we're talking TSH, we're talking T4, T3, then TT3, TT4, right? Or reversed. And then what's the story about these antibodies? You know, people talk about antibodies all the time. Does that mean that you should check your antibodies if you're young? Because maybe you're going to have thyroid disease when you get old?
You know, that's a great question. I check antibodies on everybody, because the antibodies are a sign of an autoimmune issue. Okay, now that brings us down a whole new pathway of the gut, and we can talk about that sometime. But that's where our immune system is. So when you look at somebody and they have this TPO and TGA antibodies, okay, people may know that as Hashimoto's or Graves' disease, okay? And what that tells me is that those antibodies can impact the conversion of T4 to T3. So again, you can have a normal T4 and a normal TSH, but you can't convert the T4 to T3 because the antibodies are preventing that. Okay, so now you get into the realm of autoimmunity. Okay, now conventional docs have told patients, we don't know why you have Hashimoto's. There's no known cause. There's no cure, which is not true. Okay, we know that in pregnancy, okay, those antibodies will often go down to 0 because the state of pregnancy is a state of immune privilege. So now the pregnant state modulates the immune response and those antibodies go down. I see patients all the time. We do gut testing. We fix their diet. We do things to heal the gut, and those antibodies will come down. And there are medications, too, that we use.
Wow. So I don't want to go down this path
Not today.
too far, but I have this really interesting situation. We had a brand new client yesterday who has definitely had some issues with her thyroid when she was young, and diagnosed with thyroid disease, genetic history, when she was 15. However, her hair loss slowed when she was around 2021. Then she went having children, right? So that's what reminds me, because we talked about that stage, because the hair is typically very healthy. It looks amazing, right? When you're pregnant. Then boom, 3 months after the baby is delivered, you start having telogen shed. So how does that affect then that thyroid issue that you were just talking about when, what did you call it? Something about
immune privilege?
Yes, yeah. Immune privilege.
It's interesting because a lot of thyroid problems pop up after delivery in the postpartum period. And sometimes that could be antibodies, but a lot of that is related to food sensitivities, because the food can stimulate inflammation in your gut, which then cause to problems which we call leaky gut. And again, that's another conversation. But that's where the immune problem comes in. So you have to go to the source of the problem. What's causing the autoimmunity? Okay.
Right.
So there are cures for it. There are things that we can do.
Okay, so Dr. Jack, this is getting us along very well. So we know about the diagnosis. So you went through all of the symptoms that we can face and that we might be experiencing. Then we have our labs looked at quite more in detail, I would say, than the typical just TSH and T4. Now, talk to me about treatment. What are we going to do? How are we going to treat these symptoms? How are we going to sleep better? How are we going to stop our hair from falling out? How are we going to help our weight gain or constipation?
The beauty of treating the thyroid and doing functional medicine is that it's a very individualized treatment. So not everybody will benefit from the same treatment, but the vast majority of patients will do better on combination therapy versus monotherapy. What does that mean? Monotherapy is giving somebody Synthroid or levothyroxine or T4. Okay, so the classic low thyroid patient has a low T4 and a high TSH. So you give somebody T4. What happens? T4 goes up, TSH goes down, problem solved. Not really. You've just corrected the numbers. You haven't fixed the problem. So they did a study. They asked patients who are on Synthroid alone versus somebody who is on combination therapy, either with a glandular like Armour thyroid or NP thyroid, or a combination of T4 and T3. And they found that like 85% of the participants said that they felt better on combination therapy. Okay? So the conclusion of the researchers was this. We don't see any medical benefit. Even though patients felt better, we don't see any medical benefit to combination therapy. Therefore, we don't recommend it. So all that matters is the numbers and the medical benefit, not what the patient feels. Okay? We're supposed to be in medicine to improve people, to help them with their symptoms, help them with quality of life, as well as correcting abnormalities and imbalances. So my patients, I can probably count on 2 or 3 fingers the number of patients that are doing well on monotherapy, Synthroid alone. The vast majority of my patients are on combinations of either a glandular, T4 and T3 together, compounded thyroid, or a combination of a glandular and T4.
Okay. So then, hence, this makes a lot of sense why you went from traditional medicine or conventional medicine into functional medicine. When this transition takes place and we look at this combination therapy, as I'm going to refer to it, and we talk about these glandular benefits, dive into that a little bit more so that we can understand specifically what is going to happen to our symptoms. How long is it going to take to feel better?
Sure. That's a great question. A glandular is a thyroid preparation that comes from an animal's thyroid gland. Okay, so the most common thyroid gland that we use is the pig's thyroid gland, or it's porcine. So Armour and NP, Nature Thyroid, those are porcine glandulars. Now, the benefit of a glandular is that you not only get T4 and T3, you get all the micronutrients that are found in the thyroid. So you get T2 and T1. T2 and T1 are building blocks, so you can make T3 and T4 from those. Iodine, zinc, selenium, some iron, some vitamins, and so on. So it's a complete product. Now, conventional docs don't like glandulars. Many of them don't like glandulars for 2 reasons. One is they say it's they're hard to regulate, and 2 is they say that you're going to develop antibodies because it's a foreign protein. It's an animal protein. Okay. Well, the reason that they say it's hard to regulate is because the amount of T4 and T3 in a pig's thyroid is different than the human thyroid. So you have to be able to adjust those numbers based upon your tests. As far as developing antibodies, if you're going to develop an antibody to a porcine glandular like Armour, then you better not eat pork ribs or spare ribs or anything like that, because those are foreign proteins. Well, clearly that's not the case. Okay, so when we do thyroid replacement, we tailor that thyroid replacement to the patient's needs. Now, just because the numbers are normal doesn't mean that the patient's going to feel well. So we have to use their symptoms to guide us where we should go to treat. The symptoms aren't there just to make them go away. That's how we're trained. Mm-hmm. But the symptoms guide us to the problem. You fix the underlying problem, the symptom should go away. If you fix the underlying problem and the symptom doesn't go away, there's something else going on.
Right.
And usually that's stress and the adrenals blocking. Conventional docs know that as relative thyroid resistance. Okay, so all your numbers are normal, conversion is good, there's no antibodies, everything is perfect, but the patient still has symptoms. It could be iodine deficiency, or it could be something blocking the receptors. Okay, so that receptor is the key.
Right. Well, and so the one thing that I know has helped us a lot just kind of get to the bottom of some of the hair loss issues is our hair follicle test, to when we can look at the body from an epigenetic level, right? And look at what is going on with the sensory system, what is going on in the gut, what is going on in the processes. And so certainly from there, we're able to at least start to address some of those issues from a high level and then move that client on to a specialist such as yourself. Yeah. Have you found over the years of specializing in more functional medicine that there's one particular area of treatment that seems to slow that aggressive hair loss or that aggressive shed down sooner than later?
You know, I think it's multifactorial. Okay, I can tell you that from hormone standpoint, progesterone thickens hair. So a lot of women start to lose hair. We give them progesterone. We balance their hormones, and that improves. A lot of it is thyroid. Okay, patients could be iodine deficient and not know it, yet their T4 and TSH is normal. So you optimize their thyroid function, and their hair loss improves. It could be stress. We see a lot of patients that have adrenal dysfunction. And again, conventional medicine tells us that it's either high, low, or normal. Well, with the adrenal glands, you either have Cushing's disease, Addison's disease, or everything else is normal. But I will tell you that in that normal, 95% normal range, there's a lot of dysfunction. That can affect hair loss. Cortisol can block the effect of thyroid and of these other hormones. So even if your hormones are perfect, you may not get the effect of that. So addressing all of those areas is important.
Oh, most definitely. Well, and as we've talked this afternoon through this episode, of talking about the importance of the thyroid, diagnosing the proper issues, right? And if you're not able to get those detailed answers from your conventional physician, and if you're still having all of these symptoms, that the individuals, no matter where they are in the United States, need to maybe have support from a functional physician, right?
I agree. And it's not just that they're not getting the support or treatment from their physicians. I've had patients tell me that their doctors have told them not to come back if they're going to take a glandular. They will only give them Synthroid or levothyroxine. And that's it. And patients leave.
Wow.
They leave their doctors. It's terrible.
Well, and I mean, the world of medicine is ever changing, and it's so complex. Just our simple world of hair loss. I mean, it's so the scalp and the hair is
Sure.
just so complex and so detailed that I can only imagine how difficult it is for conventional physicians to know as much as a functional physician knows.
That's why we call it practice.
That's right. Exactly. So, we've talked about those labs. Okay. So if you're still having these symptoms, dive in a little bit deeper. Find someone who can certainly research and go after looking at those detailed labs. Then talking about the treatment, the difference between granular treatment versus just conventional treatment. If we have a listener who is truly experiencing this hair loss and they're unsure, but they know that they have some of the symptoms that we've mentioned today, when they start to look for a functional physician, is there anything in particular that, if someone is in St. Louis or someone is in Canada or Arizona or wherever, right, in the U.S., and they're not able to get an appointment with you versus telemed, is there something that you can offer them as a recommendation that they should look for when they're trying to search their general area for a functional specialist?
Sure. The American Academy of Anti-Aging Medicine, where I did my fellowship, is based out of Boca Raton, Florida. Patients can go to their website and look for a fellowship-trained, board-certified functional medicine doctor in their area. I have patients all over the country, as you do,
Yes.
and they do telemedicine. They come to see me for their first visit because I just think that's good care. They need to come in, let me examine them, lay hands on, eyeball them, talk to them.
Mm-hmm.
And then I have patients that I just do phone consults with all the time. So getting somebody, I think, that's board certified and fellowship trained, I think, is the key. When patients come to the doctor and they have hair loss, you work on their hormones, and they go to somebody like you to help them with their hair loss. When you see somebody who's having hair loss, you know this. You have to look at their hormones and make sure they're, because your therapy is not going to be as effective if their hormones are not working, and my helping them with hair loss is not going to be as effective unless they have the modalities that you do. So it's really a very close working relationship between the hair and the thyroid.
Oh my gosh, so well said. Thank you, because that's so true. Well, and I think, when we opened our clinic here in the Tennessee area in Nashville, we wanted to make sure that we had a medical director who truly understood trichology. Mm-hmm. And I remember the first time that we met for coffee, you said, "Oh, sure, I know exactly what a trichologist is." And so coming from the East Coast, it was great and so refreshing to know somebody that truly did understand and appreciate the knowledge that we have, because it is very myopic, it's very specialized, but that's what we need to do.
Well, something, functional medicine changed my life personally, and it changed my patients' lives and how I treat my patients. And to me, I think it's criminal that they're not teaching this in medical schools. Mm-hmm. And as I've told people before, I've been on the teaching faculty at the University of Connecticut, the University of New England School of Osteopathic Medicine. I've lectured around the world, and I have never been asked to speak at a medical school. Never.
Wow. Well, their loss. Well, we do want to thank you.
Is that hair loss or hair loss?
That's right. I know. Well, this has been so enjoyable, and we're so thankful to have you and that you took a few moments of your time to help all of the listeners today. I do want to remind everyone that we did kind of touch on the gut health a lot today, and we're going to be coming back to that in numerous episodes as we move through our podcast. But we do want to thank you so much for being with us. We also want to let the listener know again kind of the name of your clinic and making sure that they can reach out to you. So Can you give us that information and maybe the best email address also if they would like to reach out to you?
Sure. It's Nashville Hormone. It's on Mallory Lane in Franklin. The website is nashvillehormone.com. Okay. The email address, it's probably best to use my nurse's email address because I've got 50,000 emails, and, I'll have to retire to check all my emails, which I'm not ready to do. But it's Lisa at nashvillehormone.com, and it's LESA. Lisa at nashvillehormone.com. If you want to call, the phone number is 615-964-5871.
Great. Well, thank you again so much.
My pleasure.
We look forward to talking to you again soon.
Thank you for having me.
Okay.
Right. Bye.